Good morning, USRNs. Today we will talk about neurovascular. Kasama po dyan si spinal cord injury, cranial nerves, seizures, multiple sclerosis, demyelination disorder, Guillain-Barré syndrome, neurotransmitter disorder, neurovascular disorder, Parkinson's, amyotrophic lateral sclerosis, myasthenia gravis, Alzheimer's disease, and si Huntington. So neurovascular, sino po ba yung pinaka most powerful organ? Yan po si brain. Si brain meron siyang tatlong parts. Si cerebrum, which is yung major lobe, si cerebellum, which is for motor movement, si brainstem, which is the respiratory center, where medulla oblongata is. Merong lobe si brain, frontal, temporal, occipital, and parietal. Frontal, nandito yung personality, attention, focus, speech, and thinking. Mnemonics dyan is past. So pag napapansin nyo kapag nag-iisip yung tao, hinihimas niya yung noon niya kasi that's where the focus is, that's where the thinking is. Kapag nagka-problema kay frontal lobe, ang condition po na yan ay tinatawag na Broca's aphasia or global aphasia. Yung Broca's aphasia, it sounds like voca, which is voice. Temporal naman, this is where our memory, language comprehension, and hearing is formed. Nandyan po ang Wernicke's area, which is for our language comprehension. Kapag nagka-problema kay Wernicke's area, magkakaroon po ng receptive aphasia si patient or global aphasia. Just like the frontal lobe pagdating naman sa Broca's aphasia. Si occipital naman nandyan for vision and parietal is for temporary sensation. Meron tayong divisions of brain. The central nervous system kung saan kasama si brain and spinal cord. We also have the peripheral nervous system, which is somatic and autonomic. Si somatic, ito yung voluntary system. Kasama dyan si bones and muscles. Si autonomic naman, which sounds like automatic, ito yung organs na kahit hindi natin i-control, nagpa-function siya by itself, like the lungs, the heart, the kidneys, and the intestine. Ang subtype kay PNS are sympathetic and parasympathetic nervous system. Si sympathetic nervous system, ito yung flight or fight response. Anticholinergic, sympathetic. Si parasympathetic nervous system naman, rest and digest. Dito naman, si cholinergic and si parasympathetic. So pag-uusapan natin yung anticholinergic saka si cholinergic. Nakikita nyo dyan si vital signs from blood pressure down to tears and saliva. Kapag anticholinergic, tatandaan na from glucose pataas sa blood pressure, tumataas pa yung effect ni anticholinergic. Kapag si PNS naman, which is the cholinergic, from glucose hanggang sa blood pressure, bumababa naman yung symptoms the patient would feel. So, you will see the blood pressure for anticholinergic, it's hypertension, heart rate is tachycardia, respiratory rate is tachypnea, temperature is hyperthermia, and glucose is hyperglycemia. Kay PNS naman, cholinergic, bumababa lahat. So in contrast with SNS, the blood pressure is going down, heart rate is bradycardia, respiratory rate is bradypnea, temperature is hypothermia, and glucose is hypoglycemia. Pagdating naman sa eyes and lungs, dalawa lang yung pwede mangyari dyan. Kay anticholinergic, dilated pareho, whereas kay cholinergic, constricted, both eyes and lungs. Sa gastrointestinal tract and GUT, genitourinary tract, magkakaroon ng constipation and oliguria. So dito, bumaba naman yung effect ng anticholinergic. So sa GIT magkakaroon ng constipation, sa GUT magkakaroon ng oliguria. Kabaliktaran naman ito si cholinergic, which is kay GIT magkakaroon ng diarrhea, and GUT magkakaroon ng polyuria. So increase naman yung effect. Kay uterus naman, kay anticholinergic is relax. Kay cholinergic naman is contracted. Pagdating naman sa tears and saliva, anticholinergic, dry effect. Kabaliktaran naman sa cholinergic, which is wet effect. So dito tayo sa complication of spinal cord injury. Meron tayong autonomic dysreflexia, which is the severe form of spinal cord injury. The site is on T6 and above. The causes are noxious stimuli. Meron tatlong signs, which is distended bladder, fecal impaction, and kink catheter sa urinary. Those are the causes. Again, distended bladder, fecal impaction, or merong kink sa catheter. Yung signs and symptoms naman ni autonomic dysreflexia are hypertensive crisis, diaphoresis, fever, palpitation, piloerection or goosebumps, nasal stiffness or stuffiness. Yung management kay autonomic dysreflexia, of course, kasi yung cause niya is noxious stimuli, we need to treat the cause. Paano ba i-treat yung cause? We need to check for the bladder, check for the urinary catheter, offer stool softener for fecal impaction. Ang emergency naman dito kay autonomic dysreflexia under spinal cord injury is potent hypertensive crisis. This is the emergency case for autonomic dysreflexia, hypertensive crisis. So, paano natin i-address si hypertensive crisis? We will give patient potent vasodilator. We have hydralazine and sodium nitroprusside. Again, hydralazine and sodium nitroprusside. Position the client on a high Fowler's position. Pag hindi nyo nakita si high Fowler's position sa choices, you can choose or select neutral position. So, ano yung sequence of management? So, this should be in order. First, you need to treat the noxious stimuli. If it's untreated, you need to report to healthcare provider and offer hypertensive meds. And the last one would be positioning. Ang pangalawa naman ay si peripheral nervous system. Pag matatandaan nyo si peripheral nervous system, ito yung automatic na organ sa ating katawan. Nandyan si lungs, si heart, si kidneys, si intestine. And sa somatic naman, controls and voluntary organs like bones and muscles. The cranial nerves, meron tayong 12 in order. olfactory, optic, oculomotor. This is for pupil constriction. Trochlear. This is for 6 cardinal glazes. Yung upper right left eyes, lower right left eyes, upper left right eyes, upper left right eyes. Trigeminal, this is for mastication and facial sensation. Abducens, lateral eye movement. Facial movement. 2/3 of anterior tongue or taste buds. Acoustic, glossopharyngeal for swallowing, vagus for gag reflex, accessory for breathing aid, hypoglossal for tongue movement. O, O, O to touch and feel a girl's vajayjay, as such heaven. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, accessory, hypoglossal. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, accessory, hypoglossal. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, accessory, hypoglossal. For peripheral nervous system, we have the cholinergic effect. Ito yung mga olols, beta blockers. Another example is diuretics, NSAIDs, insulin, antihistamine, antihypertensive drugs, yung may mga sartan, losartan, at iba pa. Ito yung mga contraindicated drugs ng PNS or cholinergic effect. SNS, desmopressin, side effect nito is hypertension. Another contraindicated drug under SNS is atropine sulfate. It blocks the nerves stimulation. It also increases the blood pressure. Salbutamol, epinephrine, which is a bronchodilator, and inotropic drugs. Pagdating naman kay seizures, the normal seizure time is 1 minute. If it's more than 1 minute, that's already an emergency. Seizure means rapid firing of the brain. Causes of seizure, we have PATE, problem in the sodium or problem in sodium and electrolyte imbalance. Autoimmune, so pwede tayo magbigay ng corticosteroids. Infection, so pwede tayo magbigay ng antibiotics. And trauma. And hereditary. So again, causes ng seizure is problem in sodium electrolyte imbalance, autoimmune, infection, trauma, and hereditary. There are 2 types of seizure. Grand mal seizure, which is the tonic-clonic, and the petit mal, which is the absent seizure, kung saan si patient ay magkakaroon ng blank stare, especially in pedia. Ang patterns naman ng seizure, we have 5. We have pre-ictal phase, unconsciousness, tonic, which is stiffening of the body, clonic, which is involuntary muscle movement, and post-ictal phase. So pre-ictal phase, unconscious, tonic, clonic, and post-ictal phase. Signs and symptoms ng pre-ictal phase, patient will have epigastric pain even with food. The patient will also experience metallic taste, There is also sudden flashes of light and smell of burning wire. Yun yung pre-ictal phase. Tapos kapag unconscious na si patient, you need to turn the patient on his or her side to prevent aspiration. Again, si tonic is stiffening of the body. Si clonic is involuntary muscle movement, so we need to maintain safety to the patient. Si post-ictal phase naman, yung pinakadulo, yung management is to reorient the patient and to feed the patient. Never feed the patient while the patient is on seizure. Management sa seizure, we have non-pharma management. Again, we need to turn the patient to the side to prevent aspiration. We need to remove objects that may harm the patient. Loosen restrictive clothing. We need to raise the side rails if in the hospital. Do not put anything in the mouth. Remove the pillow if seizure in bed. Put pillow if the patient is on the floor. Suction machine should be ready at the bedside if it's in a hospital setting. Of course, oxygenation. Medication for seizure is anticonvulsant, and the diagnostic test to check on seizure is EEG, electroencephalogram. Complication of seizure, we have irreversible brain damage. Ang tawag nito is status epilepticus. This is an emergency case. There are 5 continuous episodes of seizure. Yun yung kaninang binanggit ko. This is again irreversible. Status epilepticus. Management or drugs for seizure, we have diazepam via rectal. Rectal kasi mahirapan tayo mag-administer through IV, through PO, through injection. So it's better if we will administer it via rectal route. And of course, since this is an emergency case, we need to report it to the doctor. For multiple sclerosis, this is an autoimmune disease. It is irreversible, so it's not curable. This is common among female and pregnant women. Signs and symptoms, we have the early signs, which is progressive. Una, the patient will experience visual disturbances, kagaya ng diplopia, wherein there are double vision to the patient. Patient will also experience scotoma, which is the dark spot on the middle part of the of the eye. Scotoma. Dysphagia is among the early signs of progressive multiple sclerosis. So management for that is aspiration precaution. The patient needs to be positioned upright. There is thickening of liquid. Yung management niya is to give thickened liquid to the patient like honey and yogurt, etc. You also need to flex the neck to facilitate swallowing. The third one is respiratory depression, which is an emergency and could be cause of death to patient. And the fourth one is there is a decreased function of the gut and GIT. Ang late sign naman ni multiple sclerosis is ataxia, which is an unstable gait. Other manifestation of late signs are numbness and spasticity. Hallmark sign of multiple sclerosis is Charcot's triad. Charcot's triad. Mnemonic SIN, SIN. Scanning speech, ibig sabihin parang robotic tone. Intentional tremors, nystagmus. Scanning speech, intentional tremors, nystagmus. Management for multiple sclerosis, because this is autoimmune, number 1 is corticosteroids. Number 2, muscle relaxant. For example, Flexeril, baclofen, methocarbamol, dantrolene, sodium. Oxygenation, assistive device, and mechanical ventilator. Do not put patient on a hot bath or shower. There is no diagnostic test for multiple sclerosis. Just watch out for early signs of the disease. So, eto, yung progression nito is from head down to the lower extremities until it causes paralysis. For demyelination disorder, the pathophysiology for that is that it starts with autoimmune cause that will damage the myelin sheath, that will delay impulses. Ang effect niya sa central nervous system is multiple sclerosis. Yun yung pathophysiology ni multiple sclerosis. Kung the effect will hit the central nervous system. Kapag sa peripheral nervous system naman, that's the Guillain-Barré syndrome. So, both Guillain-Barré syndrome and multiple sclerosis has a demyelination disorder. The cause is autoimmune, which damages the myelin sheath, which will affect the delayed impulses, both the central nervous system and peripheral nervous system. Sa central nervous system, the effect of it would be multiple sclerosis, and sa peripheral nervous system, the effect would be the Guillain-Barré syndrome. Sa Guillain-Barré syndrome, this is the opposite of multiple sclerosis. Yung effect naman nito is from lower extremities up. So it's going up. Guillain-Barré syndrome is also known as an infectious polynephritis. The cause is also autoimmune. Also, a history of infection, especially on the GI tract, due to bacteria Camelobacter jejuni. Common population ito is both male and female. Unlike sa MS, which is only to female, that is common. Ang pattern of weakness nito is ascending paralysis. So, ang ibig sabihin nun, from lower extremities up. So, signs and symptoms is also progressive. Meron din tayong early signs like dyskinesia, leg weakness, clumsiness, decreased function of the guts and GIT. It goes up to respiratory depression. It goes up to dysphagia. So, pag nakita nyo yung early signs niya, paakyat siya. Yung late signs naman, nasa pinakataas na, facial weakness. Other manifestation are numbness and spasticity. Management, because it's an autoimmune disease, corticosteroid, muscle relaxant, oxygen and mechanical ventilation, assistive device, no to hot bath. So because this is a demyelination disorder, it also has the same management with multiple sclerosis. Now let's move to neurotransmitter disorder. This is an NCLEX hot topic. There are three common neurotransmitters. We have the dopamine, serotonin, acetylcholine. Dopamine, this is used for muscle movement or reward system. Si serotonin naman, this is our happy hormone. This is the hormone that we need for our appetite. Si acetylcholine naman is for muscle strength. So again, we have three common neurotransmitter that's going to be affected. It's going to be dopamine, serotonin, acetylcholine. Ang disorders nito includes Parkinson's disease that we will discuss later, amyotrophic lateral sclerosis or Lou Gehrig's disease, Huntington disease, and myasthenia gravis. So first disorder nito is si Parkinson's disease. Parkinson's disease, there is a problem in dopamine regulation. Ang ibig sabihin nito, it's a neurotransmitter disorder which attacks dopamine regulation. So it has something to do with muscles. The main site of dopamine production is in substantia nigra. The two causes of Parkinson's disease are hereditary and autoimmune. So, we can give corticosteroids. Paano ba nangyari si Parkinson's disease? So, merong decrease of dopamine regulation in substantia nigra. It will lead to abnormality in the muscle movement or function until the patient will show signs and symptoms of cogwheel rigidity. Parang robotic yung movement niya. Meron siyang stooped posture. Meron siyang mask-like appearance or poker face. Bradykinesia or slow movement. Dysphagia. Decreased function of the GUT and GIT. Meron siyang shuffling gait. And microphobia, ibig sabihin nun, small handwriting. Management for Parkinson's disease, we can give dopaminergic agent kasi nga tungkol siya sa dopamine. Yung goal natin dito, dahil may decrease sa dopamine, the goal is to increase dopamine level. The drug that will increase dopamine level, we have the dopas, carbidopa, levodopa, dopamine, carbidopa, levodopa. Carbidopa example yan is Cinemet. That's the drug of choice. It's a combination of both to give maximum synergetic effect. We also can give out Meraplex, Synitrel, Eldipril, and Parlodal. Next one is the amyotrophic lateral sclerosis or the Lou Gehrig's. Causes nito is problem in glutamate that will lead to muscle distraction, that will lead to motor problem. So affected dyan si fine motor, tsaka si gross motor, and also tongue atrophy. Si fine motor, ang early signs niyan is fasciculation. Ibig sabihin merong tremors. That's the movement of the eyelids due to high MSG intake. That's the hallmark sign for fine motor, yung tremors. Si gross motor naman, ito yung late stage. Quadriplegia, paralysis of neck down below. The last one is tongue atrophy. That's also a hallmark sign. Si amyotrophic lateral sclerosis or Lou Gehrig's, that's irreversible. Tips to remember, there is an intact organ of GUT and GIT. Management, we have 3, Riluzole, Rilotec. Medical ventilator should be on the bedside, especially if it gets worse. Now let's move on to Huntington disease. This is hereditary. There is an abnormal increase in neurotransmitters. The signs and symptoms includes muscle strength or involuntary, or there is an extra movement because of the ACTH hormone. Like Parkinson's disease, it also affects dopamine level. So same thing, magkakaroon din ng extra muscle movements, reward system. There is also, ito naman is kabaliktaran ni Parkinson's disease. Dito naman there is too much dopamine production, which we call dopamine psychosis. Management is antipsychotic drugs. Kasi kapag sobrang taas ng dopamine level, mataas din yung parang happiness mo, grabe yung activity mo. No? So, ang goal nito is babaan si dopamine. So, we need to give antipsychotic drugs to the patient. It also affects the serotonin level, kaya nagkakaroon ng mania si patient. Chorea is also a signs and symptoms. It means sudden muscle jerking, involuntary muscle movement, that is the upper muscle and the lower muscle, up and down movement. So, tanda lang si Korea, parang North and South Korea, merong up and down. Management, because it has something to do with muscle movement or muscle strength, kailangan natin magbigay ng muscle relaxant. We can also involve patients into genetic counseling or also include family members about genetic counseling. And because there is too much dopamine supply in the body, ang tawag ay dopamine psychosis, we need to give out antipsychotic drugs to this patient. So remember, Huntington disease and si Parkinson has something to do with the dopamine level. Si Parkinson's disease, mababa yung dopamine niya, so need natin i-increase. Si Huntington naman on the other hand, yung dopamine niya is mataas. Kailangan natin papababain. Now we will talk about myasthenia gravis. Si myasthenia gravis, yung cause nito is autoimmune din. Ito naman yung problema dito ay si acetylcholine. Merong problema sa acetylcholine or ACTH, just like Parkinson's disease. Tapos, yung level of production ni ACTH, acetylcholine, is being decreased. Saan ba pinoproduce si ACTH? Sa myoneural junction. Myoneural junction. That will lead to general muscle weakness. So it still have something to do with muscle. Kapag there is a decreased ACTH production, it will lead to muscle weakness. Signs and symptoms of myasthenia gravis includes hoarseness of voice, dysphagia, ptosis or drooping of eyelids, which is an early sign, respiratory depression, decrease in GUT and GIT, ataxia. Tapos, kapag myasthenia gravis, mahina yung gravis. Mahinang gravis. Grave, mahina. Severe weakness talaga dito. Diagnostic test for myasthenia gravis, we have hydrophonium test or the tensilon test. Management dito kasi anticholinergic yung acetylcholine yung problem. We need to give out cholinesterase inhibitor or the acetylcholine inhibitor for acetylcholine problem. Example, we have Tigmines. We have two mines, neostigmines and pyridostigmines. Tigmines, this is for cholinergic crisis. You need to watch out for overdosage. Kasi pag overdose sa Tigmines, magkakaroon ng cholinergic crisis. For example, salivation, lacrimation, urination, and salivation. So more on like overproduction of those things. Pag underdose naman, exacerbation of symptoms. Dito na mangyayari si myasthenic crisis. So kapag overdose ni Tigmine or Tigmine, cholinergic crisis. Kapag underdose naman kay Tigmine, myasthenia crisis. Myasthenia crisis if there is an overdosage of cholinesterase, and this is a medical emergency or priority. We need to report it to the physician or give atropine sulfate. Atropine sulfate is the antidote for Tigmines. PNS, all vital signs will decrease dito sa PNS problem na to. Patient may also experience diarrhea, urination, lacrimation. Now we will talk about Alzheimer's disease. This is a general intellectual deterioration. Cause is aging process. There will be a plaque formation in the brain, which will lead to abnormal brain function. So kapag abnormal yung function ng brain natin, we would have poor judgment or impaired judgment, poor memory or impaired memory, and magkakaroon din tayo ng behavioral changes. So merong 4 A's of Alzheimer. That's what we call agnosia, amnesia, aphasia, apraxia. Management for Alzheimer, we need to provide nutrition to the patient because sometimes they would tend to forget that they have eaten na ba or hindi pa ba, and give them their basic needs, emotional support, safety, structured environment, and also involve them in interaction. That's a must. Medication for Alzheimer, cholinesterase inhibitor or donepezil. Complication in Alzheimer, we have sundowning syndrome, exacerbation of symptoms, wandering. That's the hallmark sign. Management for patients with Alzheimer, you need to lock the door when you leave. Parang si Sarah Geronimo lang, no? Tsaka si John Lloyd Cruz. Lock the door when you leave. So may Alzheimer pala si Sarah Geronimo. Lock the door when you leave and place the lock above or below eye level para hindi makita ni pasyente. And of course, we need to offer bright room for safety. Next one, we have neurovascular disorder. Ito yung cranial nerve disorders. We have cranial nerve disorder towards cranial nerve number 5. Si trigeminal neuralgia. This is also known as suicide disease. Sa sobrang sakit na nararamdaman ni patient, parang isipin niya na lang na magpakamatay. So, kapag suicide disease, suicide is number 5, para siyang number 5. Yung letter S is parang number 5. Signs and symptoms ni cranial nerve number 5 problem or suicide disease, nagsastart din sa letter S. Severe excruciating pain, tawag dyan tic douloureux, parang French, no? Ici beaucoup presale, 5 pesos. Tic douloureux, sensitive to extreme temperature. Yung cause nito unknown or idiopathic. Management, we need to avoid extreme temperature and avoid facial massage. Medication, because this is extreme pain, we need to give morphine. Do not give acetaminophen because acetaminophen is only for mild to moderate pain. We can also give muscle relaxant to the patient. We can also give convulsant like Tegretol. We can also give carbamazepine, Delantine or phenytoin, and dantrolene sodium, muscle relaxant. No NSAIDs because NSAIDs is too mild, no? Patient commits suicide due to severe pain. Bigyan niyo siya ng baclofen. This is irreversible. It's like 5 times brain freeze kapag kumain ka ng Slurpee from 7-Eleven. Yung mararamdaman mo na brain freeze afterwards. Sa sakit na to, it's like 5 times of that kind of a pain. The next neurovascular disorder is cranial number 7 problem. It is Bell's palsy. Si Bell's palsy meron siyang unilateral facial drooping. Para ba siyang tabingin yung mukha. Causes niya is autoimmune din. So we can give corticosteroids or it could also be viral infection. Remember sa discussion natin previously, si herpes and varicella and Lyme's disease could lead to cranial number 7, Bell's palsy. Para hindi makalimutan si Bell's palsy, cranial nerve number 7, idugtong mo lang si 7 sa dulo. Bell's palsy vein. Bisaya, Bell's palsy vein. Tapos si cranial nerve number 5 na mukhang letter S, suicide. So again, signs and symptoms, we have facial drooping, facial weakness in one side, and management dito, kabaliktaran naman to kay cranial number 5 na si suicide's disease. Pwede nating i-massage si patient sa mukha. Alright. So yung management niya, faces din. Now we have facial massage, artificial tears due to eye dryness, corticosteroids, eye patches on the affected side, and sunglasses. Ayan. Again, yung drugs niya, corticosteroids. Side notes tayo. Attention disorder, it's for children ages 6 to 12 years old. Yan yung manifestation ng ADHD. Kapag adolescent naman, it's ADD, attention deficit disorder. All neurovascular cause of death is respiratory depression. So kapag tinatanong sa exam ano yung cause ng death, tapos pag nakita nyo na yung sakit is under neuromuscular or neurovascular disorder, respiratory depression yung sagot dyan. So kapag overdosage ni cholinergic, that will be called as cholinergic crisis or wet response. So magkakaroon siya ng increased SLAD, salivation, lacrimation, urination, diarrhea. Management dyan is atropine sulfate. All neurotransmitter disorder increases neurotransmitter. So lahat ng may mga neurotransmitter disorder, expected na mataas yung neurotransmitter level. Alright, thank you so much USRNs. Good luck!